Welcome to the half hour to health. Okay, tonight we're talking about cholesterol and blood pressure. Now this is important because if you look at, the pharmaceutical products that are sold today, now, I'm not going to call them medications. What you have are companies that are actually producing a chemical product marketed to you. In fact, ask your doctor if this is right for you. Have you heard that one before? Okay, now let's look at the top sellers. Cholesterol, heartburn, arthritis, depression. Now, those are in the billions of dollars. Now, this is a market that's increasing. Okay, now, was high cholesterol a problem 20, 30, 40, 50 years ago? If it was, why is this? Is this invented, manufactured disease? In 2003, 16 million Americans were taking a cholesterol-lowering drug. Now, 38 million Americans are taking a cholesterol-lowering drug. That's about 10% of our population. Now, this is important because if you look at it, first off, hypercholesterolemia, that means elevations of cholesterol in the blood. It's an invented disease. There's no outward signs. And in fact, doctors who treat this new disease, they have to convince their patients are sick. Okay, they have to tell you that you're sick. Now, what this does is it makes you have to go in for regular blood tests because the drugs that they give you to lower cholesterol, they know are toxic. Okay, so they check you every 4 months to make sure that the liver is still functioning correctly and not damaged. Now, what they have to do, they have the U.S. government to back them. They have media campaigns to back them, to all go in and say that cholesterol is the precursor to a lot of different diseases. Now, is that true? False? I don't know. Let's cut through the BS. First off, the ALL-HAT study. Now, this one, it's the largest North American study. It's called the Antihypertensive and Lipid-Lowering Treatment to Prevent Heart Attack Trial. 10,000 people in it. Okay, 10,000 people. Now, what they did is they divided up into two groups. Okay, one group they gave cholesterol-lowering drugs to. Okay, the other group, they did standard care. What standard care means is they suggest exercise, better diet, okay, and then they followed it out. What they did was, now they followed this group, and they found out that 28% of the drug group lowered the cholesterol, 11% of the standard group lowered the cholesterol, but they found out that each group, whether you took cholesterol drugs or not, had the same death rate, same heart attack rate, same heart disease rate. Now, this is after 4 years of taking these drugs. There was no difference. Let's not stop there. Okay, look at the Prosper study. Boy, now if you're having a drug manufacturing, business, wouldn't you like a study named Prosper? Oh, that's a little sarcasm. Okay, now this is a prospective study of prevestatin, which is a cholesterol-lowering drug in the elderly at risk. Now, what they did was, again, they divided it up into two groups, one taking a cholesterol-lowering drug, one not taking a cholesterol-lowering drug. Now, total mortality and total serious adverse events were unchanged by the drug group compared to the placebo group. Except the treatment group had higher cancer risk or had higher cancer rates. I know. Let me back that up. Okay, you took the drug, you got higher cancer, no protective benefit of it. Okay, not one life was saved. Now here, Japanese lipid intervention trial. You gotta love this. Okay, 6-year study, 47,000 people. Good study. Yes? Yes or yes? Now, what they did is, you see, taking a chemical product in your system, each body reacts differently to that. Okay, it's not a consistent thing. Not every human body to every drug is going to react the exact same. So what the Japanese found, they knew that. They gave the drug to 47,000 people. Some people had no change in cholesterol. Some people had a huge lowering of cholesterol. Other people actually raised. Okay, now they went in, had a huge lowering of cholesterol, not much difference, and a mild lowering of cholesterol. So now, what they found out, though, was the people that had the greatest effect from the cholesterol-lowering drugs and the people that had virtually no effect from the cholesterol-lowering drug had the same death rate. There was no difference. There was no change. Now, this is important because, well, first off, what does cholesterol do for you? Why are we lowering it? Does it have a function? And in fact, if you are prescribed or suggested to prescribe by your doctor to take a cholesterol-lowering drug, ask them what the function is. There's two different types of cholesterol that they're going to be measuring, HDL and LDL, high-density lipoprotein, LDL, low-density lipoprotein. Anybody know which one they call the bad one is? Yeah, there is no good or bad cholesterol. In fact, if your doctor says that, fire him, because he's obviously ignorant. First off, cholesterol is the body's repair. It's elevations in cholesterol means your body has tissue damage. It's used for tissue repair. It's also the precursor to vitamin D. We talk an entire half hour on vitamin D, on how essential it is to immune system function. Okay, vital. It digests fats. It protects us against cancer and aging. Oh, what was those studies that showed an increase in cancer risk by lowering cholesterol? So it actually protects and builds your immune system. Vital for neurologic function. In fact, when cholesterol levels drop too low, serotonin receptors can't work. This leads to depression. Oh, that's okay. We got a drug for that. Now here, what does cholesterol do again? It's the main organic molecule in the brain. Cholesterol is the precursor to all hormones. It produces every glucocorticosteroid, menocorticosteroid, sex hormone. It's incredibly important in the adrenal glands. It's vital to the stress response, vital to the immune system. It produces testosterone, estrogen, progesterone. All of those are made out of cholesterol. But wait a second, if we lower that, what kind of effect will we have on the body? Well, let's say we're in the chemical manufacturing business. Who's going to get the drug? Well, 25 years ago, they said anybody that smokes or has cholesterol rates over 240. Then they had a conference in '84, and they said, hey, male or female, anybody over 200, let's give it to them. Then it's recently been moved down to 180. Yeah, 180. That's it, right. Okay. Any science behind 240, 200, 180? Any studies on that? Or is this just a random, roll of the dice to try and get more people available for the drug? Now, if you've had a heart attack, you get cholesterol-lowering drugs whether you've had it or not. Heart attack or stroke, you're instantly prescribed it. And it doesn't matter the level of cholesterol. It doesn't matter that it doesn't show any benefits. You're just prescribed this chemical product. And this is the scary part. Now, they're recommending cholesterol drugs for children. Any long-term studies on children and cholesterol? No or no?
No.
Sick. First off, you've been told that cholesterol clogs arteries. Really? Why doesn't it clog the small arteries? Okay, why does it clog the big ones? If it clogged arteries, people would be walking around with black fingers and toes. Why doesn't it clog the veins? Inquiring minds want to know this stuff. So first off, let's look at how the body works. If you have tremendous pressure inside of the bloodstream, okay, usually about 120 to 180 millimeters of mercury, okay, of high blood pressure flowing through those arteries. Now, anything that damages the arteries, what the body's going to do, it's going to lay down a protective coating of calcium, cholesterol, and fibrin. Now, this is a protective coating designed to keep you alive, so anything that damages arterial tissue is going to cause elevations in cholesterol. So cholesterol doesn't clog arteries, it's a protective mechanism. So taking this away, you're reducing your protective mechanism of the body. Now, one of the things is, if they prescribe cholesterol-lowering drugs, now let's look at the American Journal of Cardiology. What they found was that by giving you the cholesterol-lowering drug, did it clean the arteries? Did it fix the problem that they're all concerned about shutting blood supply off to different areas? Because I'll tell you right now, if arteries clog further and further and further, that can choke off blood supply to vital organs. This is a dangerous circumstance. So this means that the lifestyle needs to be changed. It means more soluble fibers have to be put in the diet. There's natural ways to clean the arteries. I'm going to show you in just a moment, but what they're saying, that by taking the cholesterol-lowering drug, even though the blood levels of cholesterol showed decreased, there is no less plaquing than before the treatment. This means that the same amount of clogged arteries existed.